I think what just keeps coming up, there's a lot of, I think, new areas that keep popping in to I think the concern and the issues around the economic implications, the financial implications. But the one thing that never goes away is the financing of the long-term care. So we just don't have a system in the U.S. to either insure against risk of needing long-term care or to support families needing long-term care. It's a patchwork. Some states have some systems. We don't have any federal system that supports it. Medicare has evolved in many ways, right? We have a new Part D program. There was a lot of attention paid to the high cost of drugs, and that received a lot of attention over time, and policy responded with a Part D benefit. But we have not seen a response by policy for the need for long-term care. And so we have families that are essentially responsible then for paying for and or providing their own care for their family members with this disease. And that is something that has not been solved, and I don't see a lot of movement on it, enough movement on it to really support what families need.
When we talk about that from a financial standpoint, I'm guessing that's not easy to handle.
No, so there's a couple things I want to say about how expensive it is to manage persons with Alzheimer's, and the numbers of 6 and coming up to 9 million. So I think the first thing that we need to think about is what is this disease? So we know this disease attacks the brain, and when it's a progressive neurological disease of the brain, over time there's cognitive impairment, there's psychiatric issues, and there's functional impairment. So over time, the person who lives with this disease has more intense needs for care and longer hours of care needs. So you have eventually up to 24 hours of care needs. So you have the value, I guess, of the time of the care. So that might be for a family, paid care, 24-hour paid care, or you could think about it if a family member is doing it, what's the value of their time? So when we think about costs, we try to think about the side that is kind of not usually valued by the market. We can't just go out and say, how much did the family member's time matter? So we put it in a dollar amount, and then we add that to all the healthcare costs. So I mentioned sort of the progression of the disease, so there's a lot of healthcare that's needed to manage the disease. But because it's a disease of older persons, they usually have other conditions also. Diabetes, hypertension, hyperlipidemia, and those are like sort of the most common among older people. And dementia makes management of those diseases more challenging. So there's a lot of healthcare costs involved for persons. So when we put those sort of healthcare costs together with the value of all of this care that's needed, at the population level, we end up with between $400 and $500 billion of care needs. Per year. And this, again, if you want to sort of put it in context, it's more than if you took the combined costs of heart disease and cancer together. So if you think about a costly disease, this is the one to think about. And part of what we do at the Schaefer Center is we think not only about how much does it cost today, but what will it cost in the future, and who is going to pay for it. So our models show that we are looking at $1.5 trillion in costs of dementia in 2050. And that's a little hard to put your head around too. I sometimes try to put it in terms of the GDP. So it's somewhere around the GDP, somewhere between Mexico and Canada. So hopefully that helps you think about what 1.5 or $6 trillion is.
From an individual dealing with Alzheimer's dementia, what's their yearly expectation of payment?
Yeah, so I think that's a really important point, is that, you know, we can look at it from the population, but we can also think about it from an individual or a family's perspective. And we estimate close to about an annual expense. Again, I'm just including the expenses that I mentioned, and I can talk about other ones that I think are not being accounted for. So I think it's an underestimate. But we're thinking our estimates are around $80,000 a year. And that's about 3 to 4 times more than the same individual who would not have Alzheimer's disease. So it's an incredible expense, an annual expense for the person and their family. And how long that they spend paying this cost? Well, on average, the individuals with the disease live about 3 to 4 years, but that hides a lot of heterogeneity. 10% of the population live almost 10 years with the disease. So this is an expense that for some families, you can talk about averages, but I don't think it really captures the magnitude of the expense. Some families are facing years and years of these incredibly high expenses. And I'd like to go back to why I think it's an underestimate.
Please.
So these are the easiest costs for us to estimate. We can see them in our data. We have tools to value family members' time, or we think we have tools. But there's all these other costs that affect families that are harder to pinpoint. So let's just say that the caregiver is an adult child in the workforce, and they need to either reduce their time in the workforce or leave the labor market. So not only is that lost productivity or lost wages, it's lost Social Security earnings when they're older. There are implications for their children and how they live. So there's these intergenerational transmission of these huge financial implications, these wealth losses, these income losses that don't affect not just the immediate family, but I would say generations below them too.